Hello, my name is Tobias WELTE. I'm the head of respiratory medicine at Hannover University and the incoming president of the European Respiratory Society. I will give a talk today about the epidemiology of chronic obstructive lung disease and the consequences out of the increase in burden of disease in this circumstance. COPD is one of the three major diseases worldwide with a high burden of morbidity and mortality, and due to the demographic changes, more patients become older and older, there will be a dramatic increase in the number of patients. However, during the last 20 years, no new drugs has been developed to treat COPD. We had a lot of advantages in non-pharmacological treatment, mainly better exercise training, increase of patients who quit smoking, and better vaccination programs. But the four substances which had been developed more than 50 years ago, which is beta agonists, anticholinergics, steroids and theophylline, are still in place to treat this disease. One of the major reasons for the disadvantages in developing new drugs is that COPD is a heterogeneous disease which includes patients with peripheral airway disease, emphysema and chronic infections like bronchiectasis. New drugs had been studied in a general population of COPD patients, but it is naive to think that one drug may solve all the problems of these different phenotypes of COPD. The future of drug development in COPD is to better phenotype the patients and to study the drugs in more homogeneous patient populations. I assume that a number of drugs which had not been successful to come to the market will come back into better designed clinical studies which are more phenotyped for different patient populations, and then there will be an advantage in the treatment of COPD. In asthma, we have seen that this kind of phenotyping works. New drugs, biologicals, are now available and showed a superior effect in patients who are not treatable before, and I'm sure this will work in COPD. So let's go on, start new studies, new drugs for a better care of our patients. Thank you very much.